We do almost all of our procedures and treatments in the office. It's rare that I have to go to the hospital or that the patient has to go to the hospital. One of those treatments is vertebroplasty, and that's used to treat insufficiency fractures or compression fractures in the thoracic and lumbar spine. Particularly older females who are postmenopausal who have osteopenia, their bones are a little weakened, and that includes both their appendicular or long bones in their extremities and their axial bones in their axial skeleton, the vertebral bodies in their spine. And when those in the spine fracture, they're very painful and it's debilitating. You'd have a previously fairly active 70-year-old woman who gets one of those. She's in bed, she can't get out of bed, she can't do her housework, she can't go shopping, she can't do anything. And staying in bed like that or on the couch or whatever increases risk as well. It increases risk, one, for continued development of osteopenia. The bones get thinner if they're not used. Bones, just like muscles or anything else, if you use them and stress them, they get stronger. They get more calcium in them and get stronger. That's one of the reasons for keeping people active. When they have one of these fractures, they're very painful. And they can hurt in the back, the chest, the abdomen. If they're not treated early on, the patient becomes more sedentary because of the pain. And that can cause not only increased risk of further development of osteopenia and weakening of the bones, and thus make them susceptible to additional fractures, it also exposes them to other risks like deep venous thrombosis and pulmonary embolus, where you develop a blood clot in your leg, in the veins of the leg, that goes to your heart, and it can be fatal. In addition, as you develop more and more of these fractures, older women become more and more kyphotic, that is, their chest becomes more and more curved, and this can ultimately produce what used to be called dowager's hump. Your grandmother or great-grandmother, you may remember, many families know that the women always end up hunched over, and this can cause respiratory embarrassment. It can actually cause pulmonary problems and breathing problems, and patients have actually died because of that. They can't cough effectively, they can't clear the mucus and secretions out of their lungs, and they can develop pneumonia and die from that. So all of those risks can be avoided if you treat the compression fracture early on. Vertebroplasty is like putting a cast on a broken bone, except instead of putting the cast on the outside, you put it on the inside. And it's done by using local anesthesia and placing 2 needles in through the back and into the vertebral body, the bone of the spine. And then after those are in place, you very carefully, of course, inject a small amount of cement. And you fill up the space in there that has fractured, and you support it. And that prevents further compression of the fracture and almost immediately relieves the pain. It's one of those procedures where the patient gets up off the table and hugs your neck and goes out into the waiting room and declares that they're cured and everybody's happy. So it's a really fun procedure for us to do. It's very gratifying. Kyphoplasty is a form of vertebroplasty. It's a balloon-assisted vertebroplasty. What is done is with vertebroplasty, you place the needles and inject the cement, and cement spreads throughout the interstices of the spicules of bone that are in there, like marrow. With kyphoplasty, you first put a balloon in through these needles and expand the balloon to make space for the cement. The end result is the same. Outcome studies have shown that there's no difference in relief of pain. The difference with kyphoplasty is a little bit safer. There's less chance of extravasation of the cement, that is, cement coming out of the vertebral body and going somewhere where you didn't want it to go. That's some place that's would be somewhere like where there's neural tissue, like nerve roots and spinal cord. And so it's a little bit safer. Until January 1st of this year, kyphoplasty had to be performed in the hospital, at least by CMS or Medicare rules. As of January 1st of this year, you can now perform those in the office, and so we'll be doing that as well.